Hello and welcome to Dentistry 101, your source for online dental education. We hope that you enjoy. Basically, the dental floss is a piece of strand which could be placed between the teeth to remove the food remnants and, more importantly, the bacterial remnants between the teeth. These bacterial remnants could produce very harmful effects such as gum inflammation between the teeth, cavities between the teeth, or even having very bad mouth smell. Brushing without flossing will not prevent these problems. Using the floss before toothbrushing is a must. If you use the dental floss after brushing your teeth, the bacteria will still be in your mouth. One of the very important secrets to have a fresh breath is the regular use of the dental floss. The oral bacteria are anaerobic and hate oxygen, and they are present mostly in the interdental places where the oxygen concentration is low. There are many different commercially available types of dental flosses, and every brand has many different types. Because there are commercially available electric toothbrushes, there are also commercially available electric flosses. They cost much more than the normal flosses and have the same effect. They also need more space and are not convenient for traveling. I recommend trying to get used to the normal dental floss because it's much cheaper and has the same effect of the other types, and also very conventional to use and does not require a lot of space like the other types of flosses. If you are traveling, you could take the toothbrush and the flossing pack with you without any problems. There are many different types of the conventional dental flosses. The most commonly available type is the pack of the floss, which you need to cut a small part and use it between your teeth. There are also commercially available dental flosses having handles which could make flossing a little bit easier. Some have longer handles to make flossing the most back parts of your teeth much easier. It is recommended to floss every time before toothbrushing. The technique of flossing is very simple. Tie a small piece of the dental floss and circle it around your index fingers of each hand. The floss should support itself without the help of the thumbs. After having a firm grip, use both thumbs to direct the floss inside the mouth. You need to place the floss in the space between every two teeth and gently go up and down while massaging the gingiva gently. Move up and down slowly and do not move back and forth. Moving back and forth will cause injury to the gingiva. This movement is only allowed while inserting the floss between the teeth. When you pass the contact between the teeth, gently go up and down, resting on each of the teeth before going up again. Don't forget to floss the back of the last tooth, which is usually the wisdom tooth. Flossing this tooth from the back will prevent the inflammation of the gums around the wisdom teeth, which could happen occasionally to all of the people. When you finish flossing, start brushing your teeth. Using the floss regularly decreases the chances of having any decay between the teeth and also guarantees you to have a fresh breath. People who have braces or have bone loss between their teeth, it is recommended to use the interdental brush type of floss. It will be much easier than the conventional floss. And this brings an end to our video Dental Flossing 101. If you like the video, please hit like and subscribe. Thank you for watching.